everyone. First and foremost, I'd like to thank everyone for coming. My name is Jay Clark, and I will be leading this HIV and AIDS awareness group. As imagined, HIV and AIDS can be an emotional and even controversial topic. I think there are many people who are uninformed and typically create their own bias of individuals with HIV or AIDS. I'm hoping this session will help you grasp a better understanding of HIV and AIDS. But first, can we all introduce ourselves? As I said, I'm Jay. I have a BSW from Brushy University, and I work with nonprofit organizations that specialize in HIV and AIDS.
My name is Heather Stone, and I also have a BSW in social work. So I thought this would be a really good opportunity to learn some more about HIV and AIDS awareness so that I can advocate on behalf of those individuals.
So,
My name is Shelby Goff, and I actually have my master's degree from Louisville University, and I have been looking more into the nonprofit side of organizations, and I think that HIV and AIDS would be a great way to start.
very much so. Okay, well first I want everyone to take the AIDS quiz. I just want to have a better understanding of what everyone does know, so I will give y'all a few minutes to answer those questions. There's only 12. Excuse any spelling errors, I did that by hand. Okay, now let's just kind of go over the answers together. Number one was, what is HIV? And it is a virus. The difference between HIV and AIDS is that HIV is the virus that causes AIDS. There is no cure for AIDS. And no, HIV does not only affect gay people. Can you get AIDS from sharing the cup of someone with HIV? No, you cannot. Can insects transmit HIV? No, they cannot. Now, how can you tell if somebody has HIV or AIDS? Some people try to say that they act funny or that they're tired and they look ill, but in all honesty, there's no easy way to tell. What does HIV stand for? It's the Human Immune Deficiency Virus. STD stands for sexually transmitted diseases. The term AIDS was defined in 1982. The practice that puts you at most risk for becoming infected with HIV is unprotected vaginal sex. And of course, abstinence is to refrain from sex. Okay. The next thing that I have for us is just a little PowerPoint that kind of goes over HIV and AIDS. The Human Immune Deficiency Virus, the reason that it has its name is the H for human. It's the virus that only infects human beings. Immune deficiency, this virus weakens the immune system by destroying important cells that fight disease and infections. And then the V stands for virus. It's a virus that can only reproduce itself by taking over a cell in the body of its host. Okay, AIDS is the acquired immune deficiency syndrome. A for acquired, you are not born with AIDS. It's something that you acquire after birth. I is for immune, it's your body's immune system. D is for deficiency. You get AIDS when your immune system is deficient. And then syndrome is just a collection of symptoms and signs of the disease. Okay, how do you get HIV or AIDS? You can only get HIV and AIDS, well, HIV, through blood, semen, which is cum, of course, the preseminal fluids, which is pre-cum, rectal fluids, vaginal fluids, and breast milk. You cannot get HIV through the air or water, insects, saliva, tears, or sweat, casual contact such as shaking someone's head, hugging them, or sharing the dishes, drinking from the same drinking fountains or toilet seats. Okay, early stages of HIV. There are some symptoms that not all individuals suffer from, and it usually happens within the first 2 to 4 weeks. And the experience of the flu-like symptoms is the acute retroviral syndrome, or the primary HIV infection, and it's just the body's natural response to the HIV infection. You'll get fever, swollen glands, a sore throat, a rash, fatigue, muscle and joint aches, and headaches. But just so you know, just because you have these symptoms does not mean that you have HIV. There are 3 stages of the HIV infection. The first is the acute infection stage. This is the 2 to 4 weeks that some people will experience the flu-like symptoms. During this time, there's a large amount of the virus being produced in the body. This person that's infected is particularly high risk for transmitting the HIV because the high levels of HIV in the bloodstream. Clinical latency stage. This is when the virus is living or developing in a person without producing symptoms. The HIV virus continues to produce at a low level. This stage can last for an average of 10 years. And sometimes it can go dormant, and that's why they say that you should get checked your 6 months and then continue up for 10 years. And then AIDS is the last stage. This occurs when the immune system is badly damaged and one becomes vulnerable to infections. Actually, your CD4 cells, if they fall below 200 per cubic millimeter of blood, you are considered to have progressed AIDS. Things that may shorten the time in between HIV developing into AIDS is old age, HIV subtype, co-infection with other viruses, poor nutrition, severe stress, and your genetic background. Factors that delay the time in between HIV and AIDS is taking the antiviral therapy, staying in HIV care, doing what your doctor recommends, taking care of yourself, and your genetic background.
I have a question.
Yes,
So-
ma'am. No, please do.
So is there a roundabout time frame in between that there usually is, or does that like really vary on the person? Like, cause I've always wondered that, is it like an average of, 10 years between, or is it?
It varies.
It
It
really
really
varies.
does vary. It just depends on, because if you're somebody who doesn't take, like, say you get HIV from shooting dope,
Mhm.
and you continue your drug abuse, you don't go to the doctor, you don't even get tested, or you don't eat properly, it's going to progress pretty fast. But if you're somebody who eats healthy, who wants to take the medication that's given, or even the factor of being able to afford the medication can also be an issue,
Mhm.
then it doesn't always turn into AIDS.
Right.
You can
okay.
keep it from, so. Okay, so just some facts about HIV and AIDS. In 2011, an estimate 49,273 people were diagnosed with HIV in the U.S.
A lot.
Yes, it is.
In 2011?
In 2011. In 2010, 15,529 people died from AIDS. And that's who had the diagnosable AIDS. HIV can hide for a long period of time, which would be like that 10-year period in the clinical latent stage. They attack the T cells or the CD4 cells. HIV can destroy so many CD4 cells that the body cannot fight infections or disease anymore. Today, someone who is diagnosed with HIV and treated before the disease progresses can live a normal life expectancy. There is no safe and effective cure for HIV, but doctors hope to find one soon.
Is there anything coming close that you know of?
Well, there are, people say that there are cures for AIDS. I've heard people say that Africa has a cure for AIDS. I've heard that somebody here in the United States have actually come up with a cure for AIDS, but the government wouldn't give them enough money for it, so they can't.
Oh.
But, okay, well, the next thing that we are gonna do is a true and false worksheet. This one was a little bit more tougher than the AIDS quiz, so.
I didn't study.
You can do this, I have faith in you. You're a social work person.
If they're false, if you know the answers to, try to write them down. Are we ready?
I think number 9's a trick question.
It could be. Okay. The HIV is most likely to attack the B cells. True or false?
False.
It attacks the T cells.
Correct.
Alright. Antibodies are proteins that destroy foreign substance. True or false? The first test given to determine the presence of AIDS antibodies is the West blot test.
I have no idea, but true.
It's false. It's the ELISA test. Yeah, ELISA. Okay, AIDS is caused by a fungus.
False.
It's a virus. Okay, being protected from disease means you are immune.
True.
Having one sexual partner is called bigamy.
False.
Yes. Monogamy. Okay, a heterosexual has sexual partners of both sexes.
False.
False.
It's bisexual. HIV is found in the highest concentrations in blood, vagina secretions, and urine.
Is that true?
It's false.
How is
It
that?
should have been semen.
Okay.
Semen.
Okay, the best way to avoid getting AIDS is using a condom.
Is that false because?
It is false because the best way to prevent any STD is abstinence.
Okay.
And AIDS destroys the body's digestive system, leaving the victim susceptible to other diseases.
False.
It's the immune system.
Oh.
Awesome. Okay, so I know that there are a lot of misconceptions about HIV and AIDS. Is there any that you have or that you have heard?
Did HIV really come from monkeys?
I don't really think that there's any way that they know that HIV come from monkeys. It's just that monkeys, if you infect monkeys with HIV virus, they become a carrier. The virus doesn't break down their immune system like it does ours. So I think that it's kind of just a cruel joke.
I see.
Yeah.
My thing is, I always when I hear HIV and AIDS, is how they always refer to gay men. That, but it's not just gay men. It's everyone.
It's everybody.
It's everyone.
But, and I think a lot of the times it's, that misconception comes up because a lot of gay men aren't as open to being gay men, and so they have their casual sex with another gay man just to get their fix, and then they go home to the wives and then give them whatever they just got, and it's just a big mess. Okay, ladies, well, do y'all have any questions, concerns, stories you want to share?
Oh.
I don't have any stories.
I do. There's actually someone that I work with who got diagnosed with HIV, and I remember it was a big deal where I worked, and basically everybody needed to come to this because they didn't realize that just because she had it, they were all gonna get it. That's what they thought.
Okay. So what did your job try to do about that?
I mean, they didn't do anything.
They
They
didn't
should
do
have, but they
anything.
didn't do anything.
They just let the people talk, like bully her and.
Well, no, it was after she had quit, and then we found out afterwards. So everybody was like really nervous and wanting to get tested because they'd worked with her for so long, and then she left, and they found that out, and then caused stress.
Oh, okay, I see. It definitely could be scary,
Yeah.
you know, that somebody, the reason that I even became interested in HIV and AIDS is that I had an aunt that was diagnosed with HIV when she was pregnant,
Yeah.
and now there's confusion about that.
Exactly.
But yeah, it's hard to be hitting your face with something that somebody not very much older than you comes down with something that could kill them.
Mm-hmm.
So
I just think people should become more aware of HIV and
very much
AIDS,
so.
how you can get it, how it can be spread,
Mhm.
before they decide to go and make these false judgments on because someone has AIDS.
Yeah.
I think this was very great, and I feel like more people should come to things like this so they can further their knowledge on the issue.
Well, thank you. If you know anybody, you know, throw them my
Yeah.
way because I'd love to talk to them.
I sure will.
All right. Well, thank you, ladies.
Thank you.